Hi, it's Rachel from UWorld Nursing. This video is on common interview questions, and today we're going to be covering the topic of conflict resolution. So let's dive in. So for conflict resolution questions, you might be asked something like this. Describe a time when you disagreed with a supervisor or manager and how you handled the situation. The question also might sound like, tell me about a time you encountered conflict or violence in the workplace and how you resolved it. So your response to conflict resolution questions should focus on the following. You want to demonstrate proper use of de-escalation tactics because you want to show the interviewer that you're able to maintain a calm and professional attitude even in situations of high stress. You want to also emphasize win-win outcomes. Remember, conflict resolution is rarely cut and dry, so you want to use resources to help solve the problem. Resources can look like many things. They could be getting additional supplies to help solve whatever issue is at hand clinically. They also might include getting the help of a coworker, another nurse, or your charge nurse. Lastly, the interviewer who's asking you this question knows that in work situations, conflict cannot always be resolved quickly or in one sitting. So you really want to emphasize proper utilization of the chain of command. We'll go over the actual chain of command structure later. Remember, this is your first nursing job, so the story doesn't have to be healthcare related. You can use examples from your time in school clinicals, or you can use personal work experiences. Remember, you want to show the interviewer, again, that you're calm and competent in situations of high stress. You never want to rudely or disrespectfully portray the person that you are in conflict with. So let's find an example to answer this question. You might have disagreed with a clinical preceptor in one of your nursing clinicals. So how would you resolve this? Well, if you're a student, that means that you would have taken the issue and gone to check in with your clinical supervisor, and she would have helped you solve the problem. If you're a nurse on a floor and you disagreed with your preceptor or nurse that's training you during orientation, you would go follow up with the charge nurse. So let's review the chain of command as a new nurse. In a floor setting, your immediate supervisor is either going to be your preceptor if you're still on orientation and training, or if you're on your own, it's going to be your charge nurse. Then after that, it's going to be your nursing manager, then the nursing director, and then the CNO, the chief nursing officer. So again, that's your chain of command to follow if you work inpatient as a floor nurse. If you're working in a doctor's office or a clinic, your chain of command would probably be your nursing manager. So this wraps up our video on conflict resolution. We hope you enjoyed it, and remember to subscribe to our YouTube channel for more content.